getting Dahlia Ackerman up here to let her do her session. She is a BSN, RN, and CNN, and certified nephrology nurse who's worked in dialysis and nephrology for the past 21 years, 15 years as an RN. Dahlia, would you like to speak out of here or out of there?
Sure.
Give you your choice.
All right, thank you.
Okay.
Thank you all for having me. I am Dahlia Ackerman. I'm a certified nephrology nurse with DaVita in Bakersfield, California. I currently work in the home department, and I'm a community educator as well. I have been in dialysis 21 years now, and I started off as a secretary and worked my way through school and became an RN. I've had the pleasure of becoming an administrator, working with new builds of new dialysis centers, and some of our pharmaceutical businesses as well. But I was introduced to kidney disease a lot longer than that. So I think I was 7, and my grandmother was a kidney patient, and she was on dialysis. And I remember the struggles that she went through, but it wasn't just her. So her brothers were also kidney patients and some on dialysis. And then my uncles, her sons, were also kidney patients and on dialysis. And I would love to say that that part of the family tree stopped there, but it didn't. So there's still a lot of kidney disease within our family, and that's a story for another day. But unfortunately, as prominent as kidney failure is in my family, it's been said that you are either a kidney patient or you work with kidney patients. So I chose to work with kidney patients. And that's what brought me to DaVita 20 years ago. DaVita is committed as a healthcare organization to ensuring that patients have the necessary tools and the education needed to navigate every single step of their healthcare journey. We need to understand that diabetes is the leading cause of chronic kidney disease. And I guess I forgot to mention about my family. What caused all of these family members to all have chronic kidney disease? And it is diabetes. It is very, very prevalent within one side of my family tree. But if we only had some education then, as if we have now, maybe things would have been a lot different. Management of diabetes is absolutely key to patient health. Management of diabetes is key to preventing or delaying the progression of chronic kidney disease and, in turn, chronic kidney failure. Anyone with diabetes can take certain actions, lifestyle measures, to ensure that perhaps they do not become one of those persons on dialysis. But if they do, we have education for that as well. So let's delve into a few numbers. 1 in 10 US adults currently are living with diabetes. That's quite a few. That's a big number. 37 million Americans have some stage of kidney disease. And out of those 37 million Americans, according to the CDC, 9 out of 10 of those persons do not even know they have some type of kidney disease. So this is where they correlate. Diabetes causes kidney disease. It is the leading cause. 1 out of every 3 adults with diabetes has chronic kidney disease. And so then why does this matter? It matters because there isn't a cure. There isn't a cure for chronic kidney disease. We have recently teamed up with community resources and community partnerships to ensure that patients become their best advocate. Early management and early detection are complete keys to slowing the progression of this disease. Whether patients are seeking resources on prevention or they've already developed the disease, we want to ensure that they're prepared for what's next. Those resources include Kidney Smart, the American Diabetes Association, and then DaVita's Transplant Smart. Kidney Smart. So Kidney Smart is a no-cost community resource available to anyone. And what you'll find here is education from experts in kidney disease. They'll teach you kidney basics, nutrition tips, treatment choices. It also includes transplant and modality education. It also includes information if a person with CKD does not want to pursue dialysis or transplantation. Again, they're open to anyone. These classes can be done virtually, by telephone, or in person. You can go to this landing site on Kidney Smart and find these resources for yourself. DaVita also recently teamed up with the American Diabetes Association, and it's designed to help people with diabetes protect their kidney health. On the American Diabetes Association at diabetes.org, you will find this landing page right here. You go to Living with Diabetes Kidney Care. It's an interactive online experience. It meets people wherever they are in their kidney health journey. It features free guidance and it removes barriers, improves awareness, and supports people with prediabetes, diabetes, and those who may already have kidney failure. The website is free to use. It's organized a lot like this. So there's 3 spots in which you can go to. I want to prevent kidney disease. That's for someone or family members who may have a family history of chronic kidney disease and they would like some more information. The next tab is I'm living with CKD. That's specifically for patients and family members who may already have diabetes and are known to have chronic kidney disease. There's a lot of information within that tab as well. And the last one is I'm in advanced progression. This is aimed at patients and family members who already have chronic kidney disease, may already be on dialysis, have kidney failure, or are known to be progressing into those later stages of kidney failure. Additionally, on this website, it'll take you into additional information on on the Kidney Smart classes as well. Now, when CKD is a reality, there's really only 2 different options from which to choose from if you want to prolong life, and that's to get a transplant or to start on dialysis. If not managed properly, chronic kidney disease, it will progress to kidney failure. DaVita is dedicated to empowering its patients to choose the right modality for them and at the right time. So in 2019, DaVita developed Transplant Smart. In this tab, you will find quite a few motivating peer-to-peer interviews with patients who are going down the same or who have went down the same transplant journey. It's pretty well animated. It's really user-friendly. And it allows patients to understand what to expect in their transplant process. There's guidebooks and handbooks in there. And there's also a lot of information on how a patient can track where they're at in their current journey. They also have support from a licensed social worker that may be able to assist with any questions and maybe delving into the complicated process of transplant. Now, we really have to talk about when end-stage kidney disease is looming and we have not chosen transplant. We would like to ensure that patients make the best choice for themselves and for their family members. We believe that every patient who is empowered to do so and educated to do so becomes their own best advocate. Kidney Smart classes offer modality education, and in 2022, Kidney Smart developed a home program for modality education. But why home programs? We'll go into that in just a moment. But patients should be able to understand the different modalities available to them. Peritoneal dialysis would probably be my first modality choice. It uses the peritoneum of the abdomen and as a filter to remove wastes and excess fluid. And it's really quite gentle on the body as compared to the other modalities of dialysis. If I had to be on dialysis and had another choice, it would definitely be home hemodialysis, which works a lot like the in-center dialysis, but you do it in the comfort of your own home. It works a lot like the same way. The machine is smaller. It's a lot gentler on the body, and it circulates the blood, removing toxins and wastes. But why home? Why do we put such an emphasis on home dialysis? Well, there's quite a few potential benefits for treating at home. Staying home, for one, not having to go to a center, more quality of life, to be able to spend that time with family, friends, and pets. More flexibility. Patients who do home dialysis have quite a few different options. Some patients will dialyze at night. Some patients will dialyze before work or after work. It allows a patient to feel as if they are in control, and that's exactly what our patients need to be, is in control. There's also some clinical benefits to it. Many home dialysis patients feel less tired, and they report having a shorter recovery time after dialysis as compared to a traditional in-center modality. So, but why home? Why the emphasis on home? Well, the emphasis on home is because of residual kidney function. And why does that matter? So most patients, when they start dialysis, still have some sort of kidney function. We have some data that shows that making even just 1 cup of urine daily lowers the mortality risk by 36%. And that's amazing. But how does a home modality contribute to that? Well, it helps keep the residual kidney function in. I'll give you 2 examples. It's done more frequently, and therefore there is less waste and less toxins in the blood, and they don't build up between treatments like a traditional every other day dialysis. And it helps to regulate fluid a whole lot better. It puts less strain on the kidneys, and both of these things actually enhance and protect the patient's natural kidney function. So in closing, patients understanding their risk factors for kidney disease is highly important. As clinicians and as patients and as family members and advocates for our patients, we want to help everyone make the best informed decision for themselves. Utilizing different resources and community resources such as Kidney Smart, Transplant Smart, and the American Diabetes Association can help patients prolong the effects of their diabetes, prevent kidney disease from progressing. Thank you all for your time.
Thank you, Dahlia. Do we have any questions out here for Dahlia?
So how often is home dialysis? It depends on the physician's prescription for the patient and how much dialysis they actually need. We have patients on peritoneal dialysis who actually dialyze every night, or 6 nights or 5 nights. We have patients on home hemodialysis who will dialyze every 4 days to daily, up to 7 days per week. But why? Because they feel so much better. Their toxins are a lot lower than a traditional in-center dialysis because you're dialyzing daily. So those feelings of nausea and vomiting are decreased much more with home dialysis. You're welcome.
Go ahead.
They are. I actually myself have 2 patients who've had previous kidney transplants, and they are still eligible to do dialysis. Now, peritoneal dialysis may not be an option unless that peritoneum heals, because we're using that lining of the abdomen. But it's definitely not a no, because I do have 1 patient on peritoneal with a previous transplant and a few more on HHD. Yes. Oh, the question was with patients who are vegan or vegetarian or who have issues receiving pork products, what other alternatives are there to heparin, which is traditionally a porcine derived medication? So I am not exactly sure what other centers use. Ourselves, we can use a citrate type medication to ensure that the blood is thin. And the other item available in our programs is to just do saline flushes. So utilizing that heparin to ensure that the blood does not clot off in the systems is what she was referring to. And so sometimes saline is used as well. Now, I'm pretty familiar with home hemodialysis, and a lot of our patients don't use any heparin at all because the amount of time that the patient is on treatment doesn't cause as much of the clotting as it does in a traditional center. So educating patients about where heparin comes from and what it is, I think that is an individual clinic conversation to have with patients. Am I aware of an exact curriculum for patients on that? I do not know. But if you do, being a patient advocate, which I believe you probably are, is having those conversations with your patients that may have an issue with that. You're welcome.
I have a question virtually. This person asking, is home hemo gentler on the body than peritoneal dialysis?
Okay, so I will give you my education, and that would be no. So peritoneal dialysis is the gentlest form of dialysis that we have. When we were taught about peritoneal dialysis and hemodialysis, with peritoneal dialysis, you have like these gentle waves, and that's how dialysis goes. And then with home hemodialysis, you have maybe these rolling hills, and that's how a patient fluctuates. And with in-center dialysis, you have what we call the peaks and valleys. So you come into dialysis, we up here and we drain you, and then you feel really bad for many, many hours after dialysis. At least that's the experience. And then we go back up the mountain and back down. So the peaks and the valleys. So is peritoneal dialysis gentler on the body? in the manner in which dialysis is performed, yes. I don't believe they are, but no, not during dialysis. So warfarin is usually oral medication taken for other issues, usually cardiovascular issues, or if you have a mechanical heart valve or atrial fibrillation. It is going to thin the blood, but not to the extent that we would want it to be when we're doing dialysis. And that's why we use heparin. Yeah, so heparin and Coumadin would be the same. You're welcome. Okay, that is a very good question. So there's a few things that you can do personally to not have those drops in blood pressures is one, controlling fluids in between treatments. Also, ensuring that you have the correct target weight that you're going to. So let's just say, and people fluctuate weight all the time, a pound here and a pound there. So ensuring that you have the correct target weight. Also, pulling fluid too fast during treatment may be another issue that you're having these low blood pressures. So what you want is a gentler form of dialysis. So if you come in, a patient comes in with 5 kilograms over, we're there trying to take off about a kilo and a half to 1.75 kilos per hour. That's a lot of fluid to come off at one time. And not all of that fluid is inside of the vessels that dialysis, traditional dialysis, can take out. So the body needs time to move from the interstitial, from your tissues, into the vascular space so we can take that fluid out. Taking too much fluid out too fast is going to cause like the cramping and the blood pressure. Yeah, you're your own best advocate. Patients who are educated are their own best advocates. And if they say, I only want to take off this much and I want to take off this much per hour, as long as you're educated in how to do that, become your own best advocate and understand that, if I take off 1.75 kilos per hour, I am going to have a low blood pressure and I'm going to have cramps. But if I take off 1 kilo per hour, I'm going to be okay. So controlling that and ensuring that you're taking off enough fluid to not get other complications like fluid overload is important. There's a lot of factors that go into ensuring an adequate dialysis, making sure that you don't have as much extra fluid on you leaving than when you came in, ensuring blood pressure is good, and ensuring that you're not hurting yourself. If I were your nurse, I would probably say that you need a higher target weight, that you need to go maybe just a little bit more. Being just a little bit wet, just a little bit over sometimes may help our patients feel a whole lot better. Remember, when you're cramping, that's also happening on the inside. And when your blood pressures are dropping, you are damaging, that cardiovascular system. So you may need a higher target weight. I would love to be at a lower weight. And when I weigh every day and, I've got this mental blockade, but we need to get away from that mental blockade of thinking I need to get to this weight and actually get to a weight where I'm going to feel good after dialysis. It's going to take you longer to recover. And that's an excellent point right there, is if we don't have that time with the nephrologist that we need during that rounding time, schedule that appointment. That's an excellent point. Yes, of course it does. If that is something that continues to be done over and over again, that water accumulation will occur. So you want to find the correct target weight. Okay, so yeah, the correct target weight. So let's just say you are a person whose target weight is 65.5, but you're having all of these symptoms. Perhaps your target weight is 66. It doesn't mean leave half of a kilo every treatment. It just means finding a correct target weight and how much fluid can be removed without you becoming symptomatic each treatment.
In the back, go ahead.
Well, it depends on the patient, of course. Nocturnal dialysis is generally recommended for patients who perhaps have really large fluid gains in between, and that is a more gentler treatment than an in-center. So let's just say you go to in-center traditional and try to remove 5 kilograms in 4 hours. On nocturnal dialysis, you can remove those 5 kilograms in 8 hours, which means there's less pull and there's less stress on the body. So nocturnal dialysis is something that you should definitely speak with your physician about if that's what you're interested in. And if you're having any issues with pulling all of that fluid, or if you have extra toxins and day dialysis is not enough, nocturnal may be an option.
Okay, thank you, Dahlia. Let's hear it for her. 21 years working in dialysis and nephrology. We sure appreciate you. That was fantastic. Great insight and wisdom with family